two households. Yes, online that I follow that. I'm doing those lessons from last and from the it's a document was not perfect. Is the music coming in? Good morning once more. It's exactly 8:05. Welcome again to this Complementary Medicines Stakeholder Engagement Workshop. Our guests online and our guests who are here with the CSIR. Ladies and gentlemen, this is an important meeting between ourselves and yourselves, as well as other stakeholders, including the Department of Health, National Consumer Commission, as well as the South African Pharmacy Council. This meeting intends to ensure that there is dialogue and understanding between ourselves so as to ensure that we can move complementary medicines as well as its regulation forward for the benefit of the South African people. Without further ado, ladies and gentlemen, I would like to welcome SAHPRA's Chief Executive Officer, Dr. Boitumelo Sumete Makokotlela, to introduce the topic of this meeting and to welcome yourselves. Dr. Sumete, come take the podium.
Thank you for those for opening the event for us, Mandimecha. Highly appreciated. Good morning, everyone. Thank you for joining us here in person. And I see we have quite a large number that have joined virtually. When I checked with the team a few minutes ago, we were sitting at about 70. I'm sure we're probably sitting at about 100 now. So it demonstrates that this session is well needed. As Madibecha says, the purpose of the session is that we can have a very focused discussion around CAMS regulations. The matters that we will be talking about today have been raised with myself and the team at various platforms, at the CAMS working group, at the captains of industry, but also you've raised it in the comments that were provided to us when we published the draft regulations. And instead of taking our typical approach of considering your comments, which were quite lengthy, I even had to print them out and really study them in detail. We thought, let's rather use the opportunity to have this conversation so that and this is what success would look like for me at the end of the session, that we walk out of here being clear on what it is that we are aligned on and are in agreement on, being clear on what we're not in agreement on. And that's just the nature of the regulator and industry, right? Being clear on that. And so that when we then go out and we publish the final regulations, we've had adequate consultation. So we're really coming into this session in the spirit of engaging and consulting and taking your views into account, but also I trust that you will take our views into account and the importance of regulating the sector. When you look at what's been happening in our country, just from the issues of spaza shops and the issue of food manufacturing, etc., you realize the importance of having a regulator. And as an industry, I think we must certainly pride ourselves that as much as we've got challenges with substandard and falsified products, some of the things that we're seeing taking place in some of the sectors we do not have because the industry is well regulated. Yes, there's gaps, we need more capacity, but at least there's clarity around regulation and who the responsible authority is. And at the core of it, which I believe is a shared goal for ourselves and yourselves, is the safety of the public. So everything we do, we always come back to, are the products that we will be authorizing safe, quality, and effective? That is primary to us. So yes, there will be instances where we're quite sticky on a matter, but it's because we want to safeguard the public. And really that's at the core of this. So we will then, Kaiser will present in a few minutes, wherein we've received comments from yourself through different ways, right? So there was a communication that was provided to us, to me, at the Captains of Industry meeting. We've received comments which are very similar to that through the draft regulations, as I've said, and we will then speak to those matters raised. I understand that not everyone had sight of that, and apologies, but I do believe that the matters that are raised are not new to many of us, right? So if we could at least accept that on the principle, on the concepts that are being raised, even though some people may have not received the document, it's matters that we all are aware of and we all need to arrive at some resolution around. We've also invited our partners and stakeholders to the session because our regulation and the areas that we regulate is not only SAHPRA's responsibility. And these are stakeholders that we work closely with on a number of areas and not only complementary medicine. So in today's session, you will see, as per the agenda, we've got colleagues from the National Department of Health, and the department is represented by Ms. Mandi, who many of you, I think, are familiar with and know. We also have the Pharmacy Council, another important stakeholder in today's discussions and really many engagements in the area of health product regulation. And we've got Ms. Zianda, who's joined us for that session. And then we've got then the National Consumer Council, Ms. Prudence, who's joined us because, again, as I say, at the end of this, it really is about protecting the consumer. So they will share how they see the importance of having regulations in place in ensuring the safety of our consumers. And then lastly, we had allowed for time for industry to respond to our response to the questions raised. But I understand that there may have been some misunderstanding, and that's okay. So what we will then do is that from 10:45, we will then utilize the opportunity for industry and all of you really to respond and ask questions around what we would have shared with yourselves as SAHPRA and our partners in this. And so we will then do that until about 12 o'clock, and then we close. We do have to finish at 12 o'clock. So we will try to keep to time. However, I do hope that when we walk out of here, we will all be aligned in terms of the position that we are taking going forward. So again, thank you very much. And I just want to thank my team for all the preparation for this workshop. And this is not typical, right? And so I had to coerce the team a lot to say, let's do this. And they're very open to that. And they also see the benefit of this engagement. I'd like to thank our partners for joining us and thank yourselves for making the time to be here with us today. So with that said, I'm going to ask Kaiser to come forward.
Good morning, everyone. My name is Kaiser Tembo. I'm the manager responsible for complementary medicines within the SAHPRA. Today, I will be sharing with you SAHPRA's responses or feedback on the list of questions that were received. Like the CEO has said, there has been some interest from industry to get some clarity on some matters, and we take this opportunity to can also engage with you. How do I move the screen? Oh.
No, se está aquí.
Oh, sí.
Thank you. Now, by way of background, I should have said, SAHPRA received a number of clarity seeking questions for considerations. And indeed, we took some time to look at the view of SAHPRA. These questions need to be responded to in writing.
Okay, please.
As we didn't get an indication of whether this responses were received by all in the industry, and maybe each of the questions and the responses that I must indicate that questions refer to them as the questions. But if you look at them in general, there are numbers that are making in the questions. So don't be surprised that we will be jumping from some questions from. The first question is that the first question if you can be able to take
No problem.
The terms are difficult to manage due to the abuse diversity and confidentiality. We believe that SAHPRA industry experience staff to understand all of this, how to this collection. Now, when we read this question, it was not clear to SAHPRA as to how the industry experience staff is proposed to be used. As SAHPRA, we are continuing that we are providing platforms that enable rigorous discussions and engagement, like the regulatory technical forum that is group which we hold almost every quarter of the year. Even above that
platform that is provided by SAHPRA. We also acknowledge that there's a need to capacitate the CM unit, the full-time staff members, and this is something that SAHPRA is looking into pursuing going. However, in capacitating the unit, SAHPRA will follow its own HR processes, ensure that suitable people are recruited and appointed with relevant skill sets to capacitate the unit. Thank you, sir. And then the second question was, resolve what is a medicine, health supplement, a food supplement, or a food. There has been a senior court of appeal ruling. I guess that was supposed to be a Supreme Court of Appeal ruling, and nothing has happened. Now, in response to this, we're saying the court judgment has provided clarity as to what is covered by the Medicines Act and what is, in terms of that, what the court has ruled on, meets the definition of a medicine or scheduled substances. Now, the proposed amendment to the general regulations that SAHPRA has worked on, which the CEO said will be considered for publication soon, have aligned the definition of a complementary medicine with that of the medicine in the Act. So that alignment is catered for in what we have worked on, and in the health supplement would also be something that qualifies as a medicine falling into the classes that are indicated. You would appreciate that there are also other stakeholders within the Department of Health that are capacitated and mandated to determine and provide for what is a food and in terms of the relevant legislation. Now, the big question is what qualifies a product as, when is a product a food or a medicine? And I have to think straight in here in giving an example. When you look into a product like turmeric, for example, it can be in its fresh or dried form. It can be a foodstuff where it is used for mainly for flavor as a flavorant or colorant in food. But like I'm saying, the Food Directorate is best suited to can also expand on what makes a product a food. Now, you take the same product, turmeric, or its extract as in tinctures. It is also known to be used in complementary discipline-specific medicines like causes of inflammation. And again, in that spirit, you take polyphenols compound, curcumin, which extracted from turmeric, can also be used in health supplement with specific claims and allowable levels. So there are many other examples that one can look at in terms of trying to demonstrate what is a food and what is a medicine. The third question says, resolve how a chem can be a chem and not a category D medicine. Nowhere in the world does anyone understand what a category D medicine is. Now, if you look at Section 35, subsection 6 of the Medicines Act, it provides for making of regulations, and it reads as follows, which I'm going to cite as it is. Subsection 6 says, regulations may be made under this section in respect of particular medicines or scheduled substances or classes or categories of medicines. Now, with that, we have Regulation 9 of the General Regulation, which provides for the categories and classification of medicines. You would note that in terms of that Regulation 9, it provides for medicines that are intended for use in animals or in humans. And it categorizes those medicines in different categories, A, B, C. And it was proper for SAHPRA to also include category D medicines. I understand that we are used to using the colloquial terms when referring to different categories of medicines like allopathic or orthodox. And I think it is maybe time that we normalize referring to these medicines using their proper categorizations as per the regulation 9, as per the regulations. The next question reads, oh, thank you. Thank you. Am I audible now? Okay. All right. Then the next question reads, then there are pure marketing companies. Where do they belong and what rules or regulations apply to them? This makes it difficult to make decisions. I thought I had some. Okay. Now, the Medicines Act and its associated regulations provide for what is a medicine and what is required for selling a medicinal product. Now, the word sell is defined in the Act, and it is clear in terms of what it denotes. In cases of a marketing company, if such a company is intend to be prospective holder of certificate of registration or owner of the product, then they would either be applying for a license to manufacture or a license to import. You would appreciate that the online marketing, in the process of online marketing, there is a product that is involved. And this product is either imported from somewhere, it is either manufactured from somewhere, stored somewhere, and will be distributed from somewhere upon the online purchase made. Now, if you are dealing with that, you will have to apply for a license to manufacture or license to import. While they may not be holding a stock or directly involved in its storage or other activities they are held responsible for, these activities and so are the license in order to demonstrate their own quality management system and how they may liaise with the relevant suppliers or otherwise. These marketing companies are also required to apply for relevant licensing as prescribed in Section 22C of the Act. The next question says, how can SAHPRA, Pharmacy Council, and the Allied Health Professional Council Acts and regulations, etc., work more congruently and more easily? Sometimes back in the 2020 or 2019, we held some engagement with industry where we came to an understanding of the challenges that they are facing in terms of the licensing processes. And after hearing the stakeholders out, we engaged with our partner stakeholders within the government, like the Pharmacy Council and the Department of Health. And that engagement culminated in the licensing process that has been aligned between the three entities and coordinated by among SAHPRA, Pharmacy Council, and the Department of Health. You would also note that the stakeholder concerns at the time was that they were faced with a chicken and egg kind of scenario where there was no clear indication of when they apply, who has to come first. Is it SAHPRA? Or if you go to Pharmacy Council, they say, no, you're waiting for the Department of Health. So the three entities worked together and came up with a process flow that will guide the process for new application for licenses limited only to complementary medicines or category D medicines. This process flow is clearly defined in our guideline 7.02. I think it is the second last, if not the last page of the guideline. And it clearly shows the steps that will follow once you apply. Just to summarize those steps, when an entity applies for a license, a category D license, as SAHPRA we say, you need to provide amongst the information that you are going to give to us evidence that you have lost an application with the Department of Health as well as SAPC. We're not saying you must have approval from those. We're saying provide us with evidence that an application with the other two entities, SAHPRA, Pharmacy Council and the Department of Health, has been lodged. And on the basis of that, we will still advance your application because we know that you have lodged the application with the other two entities. And once we are done as SAHPRA with our evaluation process, then the other two entities will take over and issue with compliance as the case may be. Now, regarding the AHPCA regulations as they pertain to professionals, are relevant to SAHPRA insofar as their access to any medicines which are scheduled may be needed and any regulations that must be complied with. So there is no ambiguity when that in this regard. The next question reads, the pharmacy licenses should be congruent. The pharmacy licenses should be congruent with what is required via Act 101. What licenses and under which category does one apply for? Now, I won't be going into details on this because we have colleagues from the Department of Health who will be addressing the issue of pharmacy licenses, and SAHPRA will engage. Then question 7, category 22C license. Category 22C license under Act 101 regulations are surely intended to license facilities and not to register or approve products. This seems to be a conflation of issues here. This should surely be resolved. Now, as SAHPRA we're saying, the licensing process is indeed only intended for licensing facilities. We don't use the licensing process to register products. However, the process is also required to verify of products that are to be manufactured and confirmation that such products are indeed complementary medicines. I mean, this is very, very critical for SAHPRA to ensure that what we are issuing a license for is indeed for complementary bona fide products. If I may take our stakeholder back in the 2002s, you will recall that we used to have that so-called MBR 20.8, where anything that is anything was coming in under the banner of complementary medicines. And people were getting those acknowledgement letters that were used for the wrong reasons, even those that are not including of complementary medicines. Now, this process of licensing is intended to make sure that whatever that we license is indeed dealing with complementary bona fide products. And the licensing also can also be from the category A, for example. You can hold a license for category A, but for you to deal with complementary products, you still have to come through the SAHPRA licensing category D process and append the category D specific products to your license after we have verified that indeed these products conform and comply to the category D requirements. At the same time, the declared level of risk allow for appropriate application of the attestation process. I think most of you you may have read through the guideline 7.02, where we also indicate how we're going to be licensing facility because we use the attestation model to license. And any medicine registration which may be required would consider the proven quality, safety, and efficacy of a medicine. You would also appreciate that in terms of the category D, which we are using only licensing as a first or primary step towards registration. When you look at other categories of medicines, licensing becomes part of the process that culminates in the registration of a process of a product. Now, we had to take this route of initiating a licensing process as a primary step, because some years back, between 2013 and 2018, there was an attempt to register this product outright. But the chems industry happened or submitted that they are experiencing challenges in meeting certain compliance requirement. So as the regulator, we had to go back, engage, and come up with a possible mechanism that would enable industry to comply when they submit to the regulator. The next question says, it must be made very clear when and where a responsible pharmacist will be required, when and where not. Now, the South African Pharmacy Council, which will be giving you a presentation shortly, is the statutory body responsible for any mandate of oversight of medicines and their production provided by way of the Pharmacy Act. The performance of any functions relating to manufacturing, exporting, selling, and distribution of medicines, Regulation 23(2)A of the general regulation made in terms of the Act requires that the applicant for a license to appoint a responsible pharmacist who will control the importation, exportation, manufacturing, wholesaling, or distribution of medicines or scheduled substance. It's a requirement in terms of the Pharmacy Act. Now, the same Regulation 23(2)B of the general regulation also identifies the appointment of a natural person who will also be appointed in addition to a responsible pharmacist. In some cases, you will have the same person occupying dual responsibilities, being a responsible pharmacist or as well as a responsible person. But in terms of the requirement currently as it is a requirement that there must be a responsible pharmacist. The Medicines and Related Substances Act does not entitle SAHPRA to recognize any other person other than someone designated by the Pharmacy Council as a responsible pharmacist to be a responsible pharmacist. So this is the requirement that is provided for in terms of the Pharmacy Act, and SAHPRA is just complying with that requirement. Question 9. How do we import products from other countries which have different standards? When is what acceptable and when not? Now, the issue of standards was long discussed as far back as 2018 to 2020. And there has been a number of engagement between stakeholders, SAHPRA, and the industry, wherein we also reviewed information that was provided to us. But having done all that, it has been SAHPRA position that applicant can submit any standard for consideration as long as it can be determined that those standards or references can be identified as tools associated with the demonstration of good quality processes associated with GMP, as the case may be. So as SAHPRA, we say any standard or reference you can submit, provided that such a standard or reference can demonstrate that the production of a particular product, it is relevant for that. The standard in general can be demonstrated to be suitable for most of the quality assurance and control processes as foreseen by GMP that would be applicable to specific product development. Now, you would also note that every product development, it may be unique in each nature. Now, hence we say, if you have any standard that you believe is relevant in the production of that product. Please submit it and we'll review it on a case-by-case basis. Lastly, if you look at the SAHPRA guideline 7.05, it does not prohibit the use of any certification provided such are justified and relevant to the specific product development. So as our stakeholder, you are welcome to submit any standard or reference that you believe in the production of your product is relevant. We will review it and respond accordingly. Question number 10. What are the minimum standards that are referred to in some of the guidelines? Can this standard be published? Again, this question ties to what I've just spoken to now. And we indicated that our guidelines does not prohibit the use of any certification or standard, provided such are justified and relevant to your specific product development. And I know we once opened that platform where we said, if our industry or stakeholders have a list of standards that they believe or they can develop, you are welcome to share with us. We will consider, review, and revert. Then question 11 says, is the technical common document CTD to be used for future product submission to SAHPRA? So I'm going to jump this one question, and I believe that something will be shared with you in this platform or in these discussions. Now you appreciate that I've jumped from question 11 to 17, and we're taking them in an order or a numbering that we received them from the writer. Across the board, packaging changes in certain companies can cost around 800,000 a shot. When is it not possible to put the information on labels of small packages which SAHPRA prescribes? What is to happen then? Now, if we look at Regulation 10.3b of the general regulations, it prescribes for circumstances of which pack sizes may require reduced amount of information. So nothing has changed in terms of what we are doing in amendment of the regulations, because the information that is required in terms of this Regulation 10.3b is still applicable and prescribed insofar as complementary or category D products are concerned. The regulation would also need to be read with consideration of information provided on the outer or inner labels. The same information is required with respect to all categories of medicines, as per Regulation 9. All those categories of medicines, this information of labeling is applicable to them, except for the consideration of the disclaimer, which has been shortened. So category D, as it is now, aligns with the reference categories selected in Regulation 9. Then we have question 18. There are effectively two separate scheduling systems. One for some chems, and just to be clear, we need to also normalize using the correct abbreviation for chems. Chems is CMS, and health supplement, and then the schedules to Act 101 for which chems, for other chems. Is this rational or viable? To the best knowledge of SAHPRA, there is only one list of schedules in terms of Act 101. And there is no separate schedules for category D, which includes health supplement. It would be maybe best if industry would have provided more information insofar as why there is a belief that there are separate scheduling for different categories of medicines. So from where SAHPRA stands, there is only one scheduling for medicines prescribed in terms of the Medicines Act. Then there's question 19. What is allowed in terms of indications that may be used is not clear at all. A quick look across industry will confirm this. Surely there can be a more common sense and rational list of indications that would be provided. Now, you would appreciate that the owners of the product takes ownership of the product in its entirety. So the indications are determined by the product innovator. And those that hold a clinical evidence that will yield the level of claim permissible against such. I mean, if I wake up in the morning and determine that this bottle of water can assist with this, I must have reasons and rationale of why am I saying this. And I must be able to can demonstrate as the innovator of the product why such indication is linked to this product. In a case of high risk indication, if a high risk indication is being made, then the owner of the product must have clinical evidence for their specific product being able to yield such a result. You need to demonstrate because you determined what the product is going to be used for based on the evidence that you have before you. If a low risk indication is made, in the case of health supplement, for example, the allowable indications are provided in the annexures to guideline 7.04. And we still continue working on expanding those indications. While for low-risk discipline medicines, the indication should align with the traditional use criteria at minimum as provided for in SAHPRA guideline 7.01. So the question that it should be helpful that a rational list of indication be published. SAHPRA cannot do that because we wouldn't know what you as the innovator of the product intend using your product for. Then there's issues of port health. There is concern that the same products are repeatedly held up by port health ostensibly waiting for SAHPRA's approval. This can sometimes be for weeks at a time. Moreover, SAHPRA is briefed to look after the safety, quality, and efficacy of a product. There surely must be an easier and better way to bring products, especially the same products, into the country. Now, I think coming to the issue of this port health, you will appreciate that SAHPRA has extended itself to try and accommodate and assist our industry in bringing in products into the country. We even went as far as, after engaging with industry, providing a platform through which referrals can be made to SAHPRA in cases where your product falls under Act 101. But bearing in mind that anything that is being imported into the country will come through the port of entry, and ordinarily the officials at the port of entry, particularly the custom officials and the port health officials, are legally capacitated to detain the importation of any goods for their verification and compliance with applicable legislation. If you're going to bring in food, for example, or other commodities that are not medicines, you may be liable to be charged import fees or duties. But when it is medicine, you will be referred to SAHPRA. And I indicated that we have an online submission. Now, with that online referral system, we have put in timelines through which you can hold us accountable to. Now, when a referral is made to SAHPRA, from the time that it is sent, it will take 5 working days for the importer to be notified of the outcome of the referral. We also take note that there are those consignments that are detained and substantive amount of time lapses while there is engagements between the Port of Health authorities, clearing agents, and the importer. And by the time such a request comes to SAHPRA, it is more than a month. And unfortunately, from our side, we can only deal with what is before us and what we have been referred to assist. Yes, we are aware that there may be some applicants who do not want to comply by referring or using the referral system, and it becomes very difficult for SAHPRA to assist in that case. Now, in cases where a previous consignment was imported and released, remember, the onus is on the importer to provide all the relevant information to be assisted speedily as possible. Now, if you imported a consignment in the past and it was released, and you come back next month and say, but this is the same consignment, you need to show us by producing documentation that whatever that is in that consignment is the same as what we released or we recommended for release in October. Simply put, when you are referred to SAHPRA, include the last recommendation for that was granted to you for last time. And in that way, it will even make our life easier because we don't even have to go deep into looking into this product again. We just verify that this is what was brought before, we looked at it, and this was the outcome that we gave. Now, until such time that SAHPRA has been provided with the information and description of consignment of products, SAHPRA will be hamstrung to assist you. And I can confirm that the process that we have put in place is not that difficult to follow. It's not that difficult to follow. And if you provide us with all the information we require, within 5 working days, you would have got an outcome. Except in cases where we have to go back to the importer and ask for additional information. And unfortunately, the response from the importer will determine how much long the review of a request is going to take. The other issue on detained products is those that are coming in for personal use, the Section 21 products. And I've seen a number of queries where the importer or the patient would come and say the product has been detained for more than 3 months. But when you start engaging them, they have not even started engaging with SAHPRA. Now, the time that is lost at the port of entry without you engaging with SAHPRA, it makes it difficult for us to carry the loss that you have incurred in terms of time at the port of entry. So we have all these processes on the CAMSA website that guides you which process to follow if you are bringing consignment for purposes of selling and when you are bringing in products for personal use. So the sooner an importer make contact with SAHPRA, the sooner SAHPRA will be able to assist you. And we urge you, when you do that, please follow the SAHPRA approved processes and include all the relevant information that our guidance documents, which is also in there, we refer to them as stakeholder notices. It gives you what is required, what information is supposed to be provided. So we as SAHPRA, we are guided by what we receive. So the sooner we get that information, the better. And we always endeavor to meet our timelines. I mean, 5 working days is not that long to prejudice any of the importers, unless if information is not provided or nothing has come through to SAHPRA. The last question on the 21 question says, the system is overly complex, leading to high cost without necessarily providing matching safety, quality, and efficacy. Now, it is not clear what this question relates to. And I think in the correspondence that SAHPRA shared, we asked that maybe this question be clarified so that SAHPRA can be able to respond accordingly based on the information that is provided. Dr. Tumi, I think this was my last slide, and I'll pause here. I'm not sure if... Okay, thanks.
Thank you very much, Dr. Tembo, for that clarification. And I hope the 21st question will be clarified further. Ladies and gentlemen, as we indicated that we are joined by key stakeholders in this workshop to ensure that we can ventilate matters as much as possible. I would like to call to the podium Ms. Mandi Bembe, who is representing the National Department of Health, and she will be presenting on pharmacy premises licensing. Ms. Bembe, please come forward.
Good morning, everyone. And again, thank you to SAHPRA for the invitation to come and address our stakeholders who apply for pharmacy premises licenses at the Department of Health. My name is Mandi Bembe, and I am in the Affordable Medicines Directorate, managing the licensing unit, which is the unit that issues the licenses to you. Pharmacy premises licenses in terms of Section 22 of the Pharmacy Act. My presentation will cover an introduction of us, because any chance we can get to just give a bit more information on what we do. We take the legislative framework of licensing, the application process, and license conditions. As I've said, in the National Department of Health, we are part of the Affordable Medicines Directorate, and our role is to ensure that there's improved and sustained availability of essential medicines. We are basically a unit that mostly provides an administrative function to some of the licenses which are provided for in either the Medicines Act or the Pharmacy Act, where it would state that the Director General will be the one to issue that particular license. We also are involved in the regulation of the pharmaceutical environment. And part of the licenses we issue are to professionals who would be health professionals, as well as for premises where medicines are handled. So where there's a medicine, we would have to be involved in making sure that the with yellow fever licenses, the act says that no one may administer the vaccine unless they are a holder of a license issued by the Director General. And so we would be the ones that would issue that particular, that would provide for the administrative process of the DG approving that license. Naturally, our stakeholders and partners in the licenses our South African Health Products Regulatory Authority, SAHPRA, who's invited us today, as well as the South African Pharmacy Council. We work very closely to try and make sure that the systems are aligned. And in explaining the process of applications, I'll take you through some of the work that we've done. So naturally, we have to align to the national drug policy, and with the goal of ensuring safe, cost-effective medicines of acceptable quality that is provided to all the citizens of South Africa. And so we as licensing would be looking at making sure that the prescribers and the dispensers are appropriately licensed in order for them to be able to handle those medicines. I've just highlighted the parts of the NDP that talk to what it is that we concentrate on, and that is to ensure good dispensing and prescribing practices, to promote rational use of medicines by prescribers, dispensers, and patients through provision of the necessary training and education. The aim of the National Drug Policy talks to ensuring that the medicine that reaches the patient is safe, that it is effective, and that it meets the approved standards and specifications. And where we come in is where I've underlined in making sure that, it does state that manufacturers and suppliers of medicines must be licensed, and the sale of medicines, it's only to be done at licensed premises or from licensed premises in terms of the Pharmacy Act. Section 22A, which is what I'm going to be talking about today, or Section 22 rather, of the Pharmacy Act 1974, talks to the fact that the minister may prescribe who may own a pharmacy. And it also talks to the fact that the minister may prescribe who may own the conditions of the ownership and the conditions upon which that ownership may be withdrawn. And so there's different parts of the act that talk to when the DG can issue a license, what is required, and the licensing of premises talks to the fact that when a person requires a license, they would apply to the Director General for the license, and the Director General may place such conditions as the Director General sees fit on the license. And this is an important part which links to the license that gets issued by SAHPRA to yourselves, and us making sure that that the license for the premises is aligned to that particular license. We get quite a lot of questions around, can the license be issued by the DG based on a resolution that is taken by SAHPRA? And we say no, because we have to draw the license number from the license that SAHPRA has issued you and place it as a condition, which I hope I can show you an example at the end. Of course, we know that the licensing of pharmacies is governed by the Pharmacy Act and the Medicines Act, and that these three organizations are involved. Just a quick one on the categories. There are 5 of them: community, institutional, consultant, manufacturing, and wholesale. And I know there's a lot of words that come out about compounding pharmacies. The pharmacies are 5 categories. The condition is what might set the one apart from another. It would be under a community pharmacy, and then the conditions would say something that says maybe limited to oncology services only, or whatever it is that the DG has provided for in terms of the condition of the license. But the license would be falling under the categories as provided for in the Pharmacy Act. The regulations relating to ownership, which were published in April 2023, effective 1st of May 2003, talk to the fact that pharmacies may be owned by, I'll call it lay persons, as the term would go, and that it provides for the fact that the owner must employ a responsible pharmacist. And I'm sure Pharmacy Council will run through the responsibilities of the responsible pharmacist, because they are the ones who, together with the owner, would be responsible to ensure that there's compliance by the particular pharmacy. In the regulations relating to ownership and licensing of pharmacies, the key important things is that the person who applies must be able to show proof that they are able to comply with GPP, and that they are able to comply with GMP or GDP as provided for. Now, this is where I think a lot of confusion sometimes comes through. As Dr. Tembo had said, which comes first, the chicken or the egg, right? And I'm going to take you through that process so that you know exactly what it is that we expect of you. But for the DG to issue the license, we must have both. How do we have both? GPP recommendation from the South African Pharmacy Council when you have applied, and the license that has been issued by SAHPRA. So while you go through the processes with SAHPRA in terms of acquiring the license, but the GPP is out, the DG doesn't move in terms of issuing a license. And just the different roles, the DG, well, this is now for, in particular, ascertaining the need would be in terms of criteria for community pharmacies that talks to distances and populations. But in this case, the establishment of need would be the fact that you have been issued with a license by SAHPRA and that the Pharmacy Council has approved your or recommended the good pharmacy practice recommendation. The DG may issue or decline a license, the DG may suspend a license, and the DG may withdraw and cancel a license. These are provisions of the Pharmacy Act. And SAHPRA, they would establish that GWP and GMP compliance, and they would issue you the license to manufacture or to wholesale. And of course, the medicine registration is part of what SAHPRA does. And Pharmacy Council partners with us with regards to pharmacies in ensuring that the operations of the pharmacies are, there's oversight on that and that they're aligned to GPP. And then they record the pharmacies and maintain the registers of pharmacies and the persons that are working in the pharmacies. The application process is as such. With the engagement with our stakeholders, Pharmacy Council, SAHPRA, we decided as the Department of Health to partner with Pharmacy Council so that you submit an application to the Director General. Remember, I said the application is submitted to the DG. The SAPC, in the olden days, it would be a paper application. We would then take it and give a copy to Pharmacy Council. They would review the plans, the different parts that they are looking at in terms of GPP compliance, and they would issue the GPP recommendation. You are applying to the Director General for a license. You are using a portal that is hosted on the South African Pharmacy Council website. It is a National Department of Health application to the Director General. So when you are applying, you'll notice that the health logo is there because it is the DG's application. And it was to enable processes to be streamlined and to ensure that you are able to Pharmacy Council and the department get access to the application simultaneously so that work can start happening without waiting for the department to send the application to the South African Pharmacy Council. It's an online application. We do not require any paper applications to be handed to the National Department of Health anymore. That stopped during the COVID time. So it is a case of every document would be uploaded. We continuously are working together to make sure that other information that we may require is cited there. If there's additional information that South African Pharmacy Council wants from you, it would be on that particular application so that we all get access to that information. So to apply, you go to the website of Pharmacy Council, you go to apply for a pharmacy license under members of the public, and you would start with the process. It will give you login details, and you would then be able to start with an application. On the Department of Health side, we would then see the application, we would check for completeness, etc., etc. Once the GPP is issued, it gets sent to you and us. So there's no need for the applicant to send the GPP. We can even see it on the system as we review applications. The day you get it is the day we also know that your GPP is out. The one other thing I wanted to talk to before I actually go to this part, it's that now at the end you get the GPP, you know that you have the license from SAHPRA. We expect you to then contact the department and tell us that you have the SAHPRA license, and you send it to us, and then we finalize the application. This sometimes takes years. It's for us to then get the SAHPRA license. What we will do is to align it to exactly what is written on the SAHPRA license, which means if you come after 3 years, and your license has a 5-year expiry date, we put the expiry date that is on the SAHPRA license because we want alignment. This is an example of the license conditions, and it says complementary medicines category D only. It talks to an expiry date. The expiry date is exactly the one that SAHPRA would have put on the license. And the condition is that provided that the license holder operates the pharmacy in compliance with license, etc., issued in terms of Section 22C1B of the Medicines Act. And it says no deviations from the conditions of this license may take place prior to written approval from SAHPRA. So whenever you then make changes and you want to add something, and I know SAHPRA will make a slight change to the license number that shows that there has been an amendment, your license is now not aligned with the premises license of the Department of Health, which means you need to apply for a reprint of the license that you have. And when you renew your SAHPRA-issued license, you apply for a reprint with the Department of Health for a license which is aligned to the one you have. They always have to match. And so when the inspectors come, they expect to see the license numbers looking exactly the same, which means if there's an _1 after that A, the license from the Department of Health should have exactly the same. And that license which is issued is then recorded with the South African Pharmacy Council in terms of the fact that, in terms of the regulations that provide for registers of persons and premises. And it's important for you to take it to them, because that's how then we know that the pharmacy, according to the Act, may not operate without recording the license. And so it's a very important part. It's not done until you have recorded with Pharmacy Council. I've put some of the contact information or the websites of the Pharmacy Council, Department of Health, and ourselves. And if you go onto the health website, on the right side, there's services and links. Under there, you'll find licensing unit and all of these applications about reprints, whether it's a reprint because you've lost your license, a reprint because you're renewing your SAHPRA license. The pharmacy license application process is there so that you are able to see what documents you must put together before you apply. And I think that the link is also available on the website of Pharmacy Council. So thank you very much, ladies and gentlemen. That concludes my presentation for today, and I hope we've clarified some of the questions that you have. And naturally, I'll be available for the question and answer session.
Thank you, Mabembe. Ladies and gentlemen, I think the presentations are quite concise, but they do provide the necessary detail. So we are really moving faster than we intended we will. So we might, prior to the discussions, have a body break, should the House wish. Ladies and gentlemen, for the next speaker, I wish to call Ms. Ziyanda Mfuku from the South African Pharmacy Council, who will be discussing GPP compliance and inspections. Thank you. Mfuku.
I feel very short on morning CEO, morning colleagues, and to those online. My name is Ziyanda Mfuku, Senior Manager Pharmacy Practice at the South African Pharmacy Council. At least the Department of Health has taken all of the flack. Any questions are going to go to Mani. Thank you. We can go to the next slide. Oh, sorry. Okay, we'll just talk to, again, we also don't talk without introducing ourselves with the objects of council, the vision of council, overview, and then we'll talk to why we are here today. But I thought to particularly highlight on the role of responsible pharmacists, because we get a lot of questions from industry about this. And we'll touch on the GPP evaluation and the recording of the license, the inspection of the pharmacies, and then we will then come to a close. The objects of council, as we know it, are in terms of Section 3 of the Pharmacy Act. And I'll highlight a few. In promoting the provision of pharmaceutical care, which I'm sure everyone in this space plays in that, in all the products that we're manufacturing, is to provide pharmaceutical care, safeguarding the rights of the public. I know this is a question we always ask as pharmacists, what is council doing for me? The first and foremost object of council is to protect the rights of the public. And so it is to ensure that we maintain and enhance the dignity of the profession and setting of standards, whether it comes to pharmacy education, pharmacy practice, registration of persons, etc. That's what the Pharmacy Council is there for. And I think at the backdrop of everything that we do is for this vision that says accessible quality pharmaceutical services for all. And so whatever we do, whether we're manufacturing, we are dispensing, offering, giving advice to a patient or a caregiver, the aim is to get to this point where the entire population of this republic and anyone we speak to, we come out having issued quality pharmaceutical services and they are accessible. This is just to introduce the 25 members of the Pharmacy Council. The registrar has joined them for a beautiful photo there. With the 25 members, obviously, we know we've elected the 9 members and the other 16 are nominated by the minister. These are the people that make decisions from regulating the space, advising the minister. All decisions come through council. And this slide just seeks to show us, colleagues, the relationships between everybody. Obviously, it's under the pharmacy legislation, the Act and all its regulations. Then council is constituted in terms of the Pharmacy Act. Council then has committees that advise council on matters. And then we've got the administration, which is called the Office of the Registrar, where we support in formulating of policy and making such recommendations to committee. They go up to council. That was just a brief so that we just see how council operates. The responsibility of the RP, and you may ask, why didn't I start with the licensing part? But I think this one forms the backdrop of it all. If we would understand why we have the RP and why we need that RP in that pharmacy, then everything else falls into place. So Section 22.4 of the Act, 22.5, talk to that, 35A, that's where all standards are set as rules, Regulation 28B of the practice regulations, and we'll go briefly into the rules relating to good pharmacy practice, which we shall refer to as GPP. I like this line because we always get a question, can I be an RP but not be present at the pharmacy? 22.4 speaks to the continuous supervision of the pharmacy. Right, so that's the first part. 22.5 then says the person we speak about shall be responsible to council for all the acts that are performed there. So if we can see that I can be home, but whatever goes wrong there, I'll take the accountability for it. Perhaps we can start that discussion, because then what happens is in front of the disciplinary committees of council, an RP arrives and says, I was not there. Who takes the responsibility? It's the person employed in terms of 22.4. 35A then talks to the control of the practice of pharmacy, which is extended in the regulations relating to the practice of pharmacy, where the scopes of practice are determined, the services in the different categories of pharmacies, and the conditions under which those services may be provided for. So it is important as an RP, or as RPs, to understand this, because we have seen over time that at times RPs are not ready to really understand the responsibility you're taking on by signing as a responsible pharmacist. Regulation 28.2 then talks about having appropriate qualifications. I would say we could take a learning or two in other sectors from industry on making sure that your RP has appropriate qualifications. I know it is quite stringent for industry on who takes on this role. And Rules 373A of the GPP then talks to the expert knowledge. So we are expecting that your RP that you employ, if you're an owner or if you are the RP, you do have the expert knowledge of the field of medicine that you are involved in your space or in the pharmacy. And then we go straight to the GPP evaluation. We have set evaluation criteria. As Mandy had spoken, when you submit the application on the SAPC platform to the DG, and I think sometimes it gets used against us, Mandy, that both the DG and the Pharmacy Council see this application. We no longer have to have paper that's moving in between buildings. We start evaluating it, right? And sometimes the GPP recommendation may come faster, and we sometimes think we can force the DG or force SAHPRA to issue a license just because Pharmacy Council is happy with the desktop evaluation. It is not so. However, we will look at the completed forms. We will look at the appointed RP. Give me a few seconds to talk about the RP issue because it is a hot debate these days because of what we call fronting, where an RP is appointed as RP, meanwhile, it's just for purposes of licensing. And we've had a few issues where we've had a pharmacy that's sitting in Mpumalanga having an RP that is in East London. And how they thought it would get over our heads that this person, and sadly enough, we also know where this particular human being works. So you just phone the powers that be where the person works. Is this person resigned or not? So we spend a lot of time on this RP issue. So if you ask yourself, why are you being sticky? We might have found something you didn't know if someone is applying on your behalf. The ownership, the DG looks at this, but we advise on this matter because the ownership regulations are also strict on who may own which category of pharmacy. So if it has been missed, we would advise the DG to say, it seems like we have a person who may not own applying for a pharmacy license, and you would have contact from the DG's office to say you may not, either declining the application or asking you to change the entire submission. And the site master file is important, and for the CAMS group, it is quite important because then we get to understand what it is that you do. Because at times you'll be asking for exemption of something, but if your site master file does not talk to what you're doing, then we would certainly say to you the two don't align. Please align before we can issue the GPP recommendation. We've had people for applying for the incorrect category of pharmacy. For example, a person selects wholesale. When you read the site master file, but there'll be manufacturing here, there'll be, where it's going to be. And then when you engage with, we made a mistake, please change it back. Then we can advise the DG that we're receiving a new PLO1 form because what is submitted does not align to the site master file. So that's when we are sticky about that part. Professionally drawn floor plans will be evaluated. It will be a desktop evaluation. If you saw on the guideline 702, we do desktop. For other manufacturers, not CAMS, if you play in both spaces, we come in even before we do a GPP recommendation, we do the first inspection. With CAMS, we don't do that first inspection, it's just desktop. And we complete that application. The trading titles, I know most of us here, if not all, have been in this space for days and for years and for decades. And so as you submit your trading title, perhaps at times we may ask, because some names are funny. Someone submitted a trading title that said Yoma Pharmacy, and they were expecting us to say yes to that name. And these meetings hold up it's my weekly highlight. You should see the names that do get submitted. So if we're a bit sticky with the name you've submitted, please excuse us. Perhaps we can then consider it that this name, you've always had all your products marketed as this. But hey, some names, yeah. Oh, when we asked for the alternative, they gave us Yoba Pharmacy. On the floor plan, we will look, it won't be different from the plans that you would have submitted to SAHPRA. So don't try and find something else, right? Because obviously you would have given a comprehensive plan to SAHPRA. Give us exactly that, because we'd be looking if you've got manufacturing areas, storage areas, etc. It is a desktop evaluation. It will be proven at inspection that you've got the correct products in terms of Rule 1.2 of the GPP on the on the nature of the premise itself and whether it is healthy enough or conducive for the storage and handling of medicines. So that's what we would look for. If you have any other specialization that you have there, we would also be looking at that. It would be in terms of your site master file that we are looking at your floor plan and evaluating. I think I've touched on all of this, so I'm going to jump quickly. Apologies, I think I swapped around my slides, but the ownership regulations will talk to who may own, services offered, and Rule 2.2 will talk directly to the fact that we'll use GMP. The organizations Mandy has touched on, so I won't even stay there. That would have the DOH application to the DG, SAPC playing the role of GPP recommendation, SAHPRA issuing the license. And the process, I'll jump to the part that says DG issuing the license, because we do get questions a lot also here that you receive a license and then you don't record it, right? The license must be submitted back to Pharmacy Council. Remember, all we did when you were applying for the license is to give DG certainty that this applicant will apply or will comply in terms of GPP. And once DG has issued that license, the applicant must then come back to record such a license. It is an online application. Don't send us paper, thank you. The person who would have access to this application would be the RP and would be the owner, right? So it would appear, oh, by the way, let me give you a tip. Even your license application, you can see on the online where if you're a pharmacist, you've got your PIN number, ID, and your password. If you're a group owner, even if you're a pharmacist or not, you'd have your group owner login facility. You're able to track at which step your application is just on the online platform. I didn't put those slides here, but you can follow it through. It is on that license that you record and pay those fees. And it is only after you have recorded that then an inspection would be scheduled. Before all that, everything is desktop. So if the inspector finds that the floor plan that you've submitted and the one that's there in the premise is not the same, they would report this, because what is approved must appear as such. And if there are any deviations, please inform council at the point of recording. That when we were building, you know, when you're building, the engineers, the city may say, no, this is not standing correctly, move it. If you do those changes, submit that final plan at the point of recording so that we are holding your final approved plan, because sometimes this becomes a shortcoming and I think it is unnecessary because you already have those plans with yourself. With inspections, I just wanted to touch on how we schedule inspections. Annually, we have a list of inspections. I'm not going to dwell much on inspections as normally I do, but the center part is very important, doing a self-inspection. The responsible pharmacist attached to that pharmacy has access. If you use the open website, it's going to be a generic paper thing that you're doing. But if you go on your P number and as the RP and search for your pharmacy there, you can do a full pharmacy inspection so that you assess yourself, right, on whether everything is still as you were. And we also say that if a new RP is appointed, within 3 months of their appointment, they must do a self-inspection. Because sometimes you say, I'm new, I didn't know we didn't have SOPs. And you've been there for a year. How were you operating? That's a very simplistic example. So the RPs, as they start, they should also submit this. But for RPs that have been there for years, by the 1st of March, you can do it on the 1st of January for that matter. Hopefully you are not doing a self-inspection on the 1st of January and you're still taking a break. But as soon as you're back at work, just submit that. And then we would evaluate the report and release the grading. You would respond online. All of this is an online access. The RP that's active, make sure you've got the correct cell phone number on your detail. Because all of this, for example, once we release a grade, you get the SMS notification that your report is available in your grade. You go in onto the portal, then you can submit a response if there were shortcomings, and then we would evaluate that. So it's a cycle that goes on with the inspections. How do you access the self-inspection? I think I do need to grab the new pages because we have done some work to make it easier to work on the secure platform, but there is a self-inspection under the practice tab of your secure platform or under my profile as the RP. You can submit, by the way, more than one self-inspection a year. You can change it at any point once you've improved yourself. With wholesale and manufacturers, we've got these types of inspection. Pre-recommendation won't apply to yourself, as I said, and for complementary medicine. New premises is after the recording of the pharmacy license. Monitoring inspections are the ones we will do on a cyclical basis. If we are a grade A, we'll see you in 3 years, grade B, 2 years. Grade C will see you every year and you'll pay for your inspection because we're trying to encourage you to comply. Re-inspections, let's say you were a grade C and you corrected your shortcomings. As the RP, you can apply for a re-inspection to improve that grading. And disciplinary inspections if there were complaints received, right? So it is important to note. I thought to close off, let me touch on this. And it's only 3, it might be a few, and they would affect us. What are some of the issues that we see on practice side or even a professional conduct is when you use third parties to distribute your medicines or your product, and the third party mishandles the product. Those with fridge items are most affected because we've seen horrific scenes. This is about a year ago, where boxes of what came from manufacturer A, it was actually from a wholesaler at that time, were being moved to pharmacies using a third party, but we saw these boxes, they had lined them up outside. It was a hot day. They had lined them up because they're dividing them amongst the drivers, right? But now there's fridge. You can see fridge stickers there. You as the RP here did the best. You packaged correctly. But what happened between yourself and the pharmacy? By the time it arrives there, so strict measures with your third-party distributors, please look out for it because it does tend to affect, because now it's going to come as if your product does not have proper quality. Please do not move yourself without doing the necessary license application for relocation. Because sometimes we arrive, you're no longer there, especially for those that don't hold stock. They do it a little bit. Those that are applicants or marketers, they just move the pharmacy. you move office. And now we arrive and inspect, and you are marked as what we call a grade D. We close down your pharmacy. Meanwhile, you're still operating somewhere. So please do the necessary applications. And then also, it is important to check. I'm not sure how much wholesaling you do at your level, but some manufacturers have wholesale aspect where they would be delivering medicines to pharmacies, etc. And you then arrive, meanwhile, that pharmacy is closed. We are working on ensuring that those pharmacies that do not comply, there is a guideline for removal of pharmacies. Council is not in the business of closing pharmacies, but if you do not comply and it will not protect the public as the object of council, then those pharmacies would be closed. We urge the profession to be alert. We have also announced on the website now the list of all closed pharmacies, so you have easy access to those lists. It's available. It's live. So if someone is closed now, when you go in tomorrow, you won't find them. So that is the story from the Pharmacy Council. I just thought to show you where you'll find the inspection questionnaires. On the website, this is the open website now under general information. You'll see under inspections, there's questionnaires. There's a whole lot of things that are there. Grading of pharmacies is there. You can go in there to understand what the different grades of pharmacies and when we will inspect. So that's the information that's there. And on the website itself, we've got publications where the legislation sits and any reports of council, the annual reports. Under legislation, we'll have the acts, the regulations, rules, any board notices. The proposed legislation is the one that's out for comment. So if you can just play around and look around what's happening on the website. And with that, thank you very much.
Thank you, Memfuko. Colleagues, we are progressing, and I think the picture is becoming clearer as to what we need. The NCC will be joining us after a short body break. So that, yeah, those who need to refill their cups of coffee may do so. Those who need to stretch may do so. So we can be back seated at 9:45. Right, 9:45 in the next 10 minutes. We can be back seated so that we can listen to the NCC while refreshed. Thank you very much. Yeah.
And this is the going back.
Good morning.
So maybe we should
Just
We got to get together.
What you say, baby?
Want to?
What I'm thinking. The previous speaker. I'll have to be on my toes.
Keep it up. Yes.
Okay, so I have to speak it.
Yeah, you can even face it. Fine.
Okay.
Yeah.
So maybe I can.
Now you'll be too fast.
Okay.
Yeah.
1, 2. On the clicker, let me see how to use it. Oh, okay. I pointed it, right? Right.
You can keep that one.
Huh?
You can keep that one. Also.
Yeah.
Ladies and gentlemen, and colleagues online, we are back. We're just allowing physical attendees to settle in for a few seconds, perhaps 30 seconds. And then we'll be back with you just now. Thank you very much. I believe we are all back. Ladies and gentlemen, at the center of the work we do as regulators and the work you do as manufacturers, distributors, and wholesalers is the patient, the client. And it is important that we have a perspective from the National Consumer Commission so as to understand their role in ensuring that all the work that we both do ourselves as regulators and yourselves ultimately are in the best interest of the patient and the client. Ladies and gentlemen, from the National Consumer Commission, I would like to welcome Ms. Prudence Muilwa, who would be discussing the role of the NCC in safeguarding the general public and providing oversight on products, not medicines. Ms. Muilwa, thank you. The floor is yours.
Thank you very much. I hope you all can see me. I'm also challenged like the previous speaker. Good morning, everyone, colleagues and members of industry. My name is Prudence Muilwa. I'm from the National Consumer Commission, and I am responsible for complaints and investigations at the National Consumer Commission. I will take you through my presentation, and basically the areas that I'm going to cover are just the application of the Consumer Protection Act. As you all know, affairs of consumer protection in the country are regulated in terms of the Consumer Protection Act 68 of 2008. The National Consumer Commission has been in existence since, I think it's 2011. Listen to it? Yes. And our responsibilities have actually shocked us as the Commission, just looking at the general application of the Consumer Protection Act. So I will take you through the application of the Act in case of conflict, quality and safety, and also, issues of false and misleading or deceptive representation. Now, basically, as I've already indicated, the National Consumer Commission is established in terms of the Consumer Protection Act. And it's meant to establish the legal framework for the achievement of consumer market that is fair, accessible, and sustainable. And our role is basically to reduce the unfairness in the consumer markets, to make sure that consumers are treated fairly. And basically, our role as the big sister of the consumers in South Africa. As you know, whenever there is an issue in the consumer market, the consumers in South Africa's first stop is to come to the National Consumer Commission. As you are aware, right now we're busy with issues of foodstuffs. And I always say, whenever I address industry, to say, please make sure that you are properly regulated. Because in the event you are not properly regulated, we step in. And our role is just to make sure that consumers are protected in anyhow. Now, whenever we deal with issues of consumer protection, like the foodstuff now, we're working very closely with the regulators in each industry. So when there's an issue like the current issue that the president spoke to a few days ago, We then moved to first work with the regulator as well as the regulations within that space. Now, when you look at just in terms of what the Act says we apply to, the Consumer Protection Act applies to each and every transaction in the country. Particularly for your case, every transaction that you conclude with a consumer, the National Consumer Commission has a responsibility in that regard. And of course, the Act also says that unless an industry has been exempted from the Act, the Consumer Protection Act would apply. And also, there is another provision in the Act that says that goods supplied to persons in the country that is exempt, even if you have been exempted, goods supplied are subject to the issues or the provisions of safety in terms of Section 60 of the Consumer Protection Act. That talks to the issues of product safety recalls and so on. So your industry has not been exempted from the Consumer Protection Act, which means if there are problems with your products and services, the Consumer Protection Act has space in that. Now, as I've indicated, goods is very broadly described in the Consumer Protection Act. Whenever you promote goods for sale, that is also provided for in the Act. And whenever there is, I've already explained the issue of transactions, as in when consumers buy medicine, use medicine, they are also defined as consumers within that space. And also when you market your products for consumption, the Consumer Protection Act would also apply, which logically gives the Consumer Protection Act or the Consumer Commission a perspective or a leg or a dog in the fight, so to speak. So even the things that we know have a potential of being sold. For example, the reason why we're able to conduct market monitoring, even though there is no transaction, we can be able to monitor the markets for compliance with the Consumer Protection Act. Now, in cases of a conflict, and I think now that we're talking about a regulated space, the Consumer Protection Act says that the provisions of both acts would apply. For instance, the regulations that apply to your products would apply, and also the Consumer Protection Act provisions would also apply. But then when there is a conflict, the one that affords consumers better protection would be those that would be applicable. So in a case where, for example, there are limitations in terms of what the act that regulates you provide for when it comes to consumer protection, whichever one that gives greater protection to consumers. We are now dealing with foodstuffs, and we're picking up some of the .za. I went 2 slides back. May I? Okay. Okay. Thank you very much. Yeah, so the slide spoke to the issues of where there is a conflict, just in terms of the general application of the Consumer Protection Act. So the Act says that if there is a conflict between any kind of regulation, including in this space, the one that provides consumers with better protection would then take precedence, which means that whenever there is a consumer complaint, for example, or there is a challenge like the one we're facing in the food industry, the provisions that provides consumers with greater protection is the one that would apply. So in terms of the application, it starts like this. If there is a conflict or there are 2 pieces of legislation that may affect consumer protection, the one that provides greater protection would apply. But in the case where, the legislation is not necessarily clear with regard to how it provides protection to the consumers, the Act provides that the purposeful meaning of whatever legislation should be done in such a way that it protects consumers. So I think that is just in terms of the application of the Consumer Protection Act as opposed to other regulations. So when we move into a regulated space, we look at the provisions in the general standards or the standards that are in that space. For example, when we look at medicine, we will then quickly look at what regulations are there in the medicine space. In the absence of those, or even in the presence of those regulations, if those regulations do not provide consumers with full protection, then the Consumer Protection Act says that we will then look at the purpose of the Consumer Protection Act in order to make sure that consumers are protected fully. And then we move to Section 55 that provides for the quality and safety of products in South African markets. The provision, Section 55, as I've already indicated, talks also to the standards provided in terms of those regulations. I've already spoken to that. For the purpose of those that perhaps did not capture what I said, is that Section 55 provides that consumers in South Africa are entitled to good quality products that are safe. And over and above that, I also indicated that the standards that are set within the sector for medicine is what we look at when we come into a sector. So that is why we always encourage suppliers to please give space for regulation in their industry so that they are fully regulated and there is no space for ambiguity, because in that space, we will then look to consumers in terms of what they had expected the product or service to be. So when there are those standards and modalities around the standard, it actually assists, because then as the Commission, we don't need to look at what the expectation of the consumer is. We look to the experts that can then explain why the regulation is the way that it is. So that is why wherever we go, we spoke to the textile industry a few months ago. We spoke to the food industry. Now, recently, after talking to them, we are faced with this kind of situation wherein we have to then move in with the general standards of what consumers expect from those products. We are busy now finalizing the peanut butter inquiry. You will soon hear about what our findings were as far as the content or the aflatoxin that was found in the peanut butter. I will then move to Section 60. I've already touched on it. That gives the Consumer Commission the right to, in reading it together with the provisions of safety. Section 60 talks about the issue of product recalls. The situation or the scenario that is set by Section 60 are that in the event where there is an issue of safety, the Commission needs to be notified. we need to get a voluntary notification from industry to say there is a problem with this product. And what it does is that it helps with the communication. So consumers in South Africa trust the National Consumer Commission. Whenever there is a recall, they don't want to hear from you, they want to hear from us. Because they also assume that there is a bias. Whenever you talk about your problem, there will be a little bit of PR that is involved. So when we speak on issues and we say, company X is recalling this product, please take it back. These are the risks that are involved. You will get all your refund. When you return the product, they listen to us more than they listen to you. I am aware that obviously the regulator also have the powers to also monitor the recalls and also institute recalls. That's why we have an MOU with SAHPRA in that regard, so that we work together in that space. When things are going well with your regulator, we wouldn't want to interfere too much to cause confusion. That is why we work very close, and the law allows for that. Only when there isn't protection of consumers in the space, that is when we move in hard, and then we not only require answers from you, but also from the regulator. And also, there are also instances where the commission can be given powers to order a recall. Like, for example, during listeriosis, we had to order a recall following the Minister of Health announcement a few years ago that, in fact, the product that was implicated, which were the meat, processed meats, polonies and stuff like that, we then ordered the company's consent to issue a recall and take back all the products that are in the market. We are still also now monitoring the recall of the instant porridge that was consumed by the children in Buffalo City that was implicated in there. We ordered that recall. We are still considering whether to put it back to market. We are still now looking at the laboratory test results to ensure that it is still safe. So that is also the mandate of the Consumer Commission. As I said, in an industry regulated by yourself, we would then contact the CEO. If there are challenges, we will work together to ensure that your product is off the market. Thank you very much. We then move to the issue of responsible marketing and general standards for marketing of goods in South Africa. Now, sorry, Section 29 is actually the other, not only complementary medicine, but also other foodstuffs out there. It is very important for the role players in the market to understand that you have a responsibility not to market goods that can be misleading to consumers, and also that are likely to imply false or misleading representations. So that is provided for in terms of Section 41. I will get there soon. But Section 21 is very clear that you cannot market any goods in a manner that is misleading, fraudulent, or deceptive in any way. And in fact, in the event where there is some ambiguity with regard to your product, you have a responsibility to clarify and give the full story in terms of what your product can or cannot do. It's your responsibility in terms of Section 21. And other things, it's just in terms of just the material aspects of your goods. It's very important that you remain truthful with regard to what your product can and cannot do. And another section, Section 41, as I've already alluded, is also very clear with regard to the expressions that you make to the consumer markets about your product. Sometimes I think just around the issues of ambiguity, the material facts about your product, the innuendos around your product, and also, as I've already indicated, issues of misapprehension. You have a responsibility to clarify that. We are now talking to a specific supplier, a very well-known brand, about the issues of country of origin around their product. The way that they've described the country of origin on their product is such that one would think the product is manufactured in South Africa, because they explain the hills and the valleys and the whatever that are associated with South Africa. So we've said to them, we require them to issue a statement by tomorrow wherein they will clarify where their product comes from, so that there isn't any apprehension. This also applies to your goods and services. And also, I think things that can be implied about some of the claims that you make about your product. It's very important that you understand that you cannot imply things or use certain innuendos in order to in trying to sell your product. So we require that persons or suppliers must not do all these things, and also not even imply that your product is associated with other products that are not clearly associated with. Yeah, I've already spoken to this. I think in a nutshell, the issues of false and misleading representations, all of us now understand that they are not allowed. And I think it's very important, because in holding suppliers accountable, we don't just deal with marketing company, everybody in the value chain. So long as you are involved, we will hold you accountable. So by supplier, we mean distributors, manufacturers, retailers, including your marketer as well. So you can't hide behind your marketer if your product is said to be doing certain things and you have not cleared the misapprehension. So in that regard, we would then hold you accountable. Yeah, I think in conclusion, I wanted to just say that, it's very important that service providers make sure that they understand the requirements in terms of their products. And I think one of the things that this workshop today, as I was listening, is meant to also build your knowledge about regulations within your space so that you can comply fully. And also make sure that in whatever it is that you do, whether it's your marketing and even your production, be focused, be consumer focused, because it's not just about making money. It's not only about you being an industry player, but it's in the most about somebody who consumes the product. Because once there is a problem, it triggers the National Consumer Commission. Yes, we work with regulators, but we are in the forefront as the big sister of consumers in South Africa. So we've got about 64 million South Africans. And I think with medicine, luckily, in other sectors, we know that there are certain products that are not used by children. So when we talk to the motor industry, we know that our target is not babies and small children. Then the thing about your industry is that from the time children are born, they already start using some form of medicine. So it's very, very important that you are consumer focused whenever you either start manufacturing and you start dealing with the product. Some of the things that were mentioned by the Pharmacy Council, it's actually very worrying. I'm not saying we will investigate the industry, but I'm just saying it's worrying in terms of just the distribution and the way that medicine is stored, because the efficacy of medicine depends on what the manufacturer says it must be kept like. If it says keep it in the fridge, we keep it in the fridge as consumers. But then if the pharmacies and also distributors are not going to align to safe handling practices of medicine, then we're going to have a problem. Because once your medication is then implied in any incident, as you heard the president speak, the National Consumer Commission has to do its job. Yes, work with the regulators, but we have to be in the forefront of consumers to talk, to advocate for them, and to make sure that they are protected in the industry. And also, I think this applies to just cooperation between entities. We work very closely now with the Department of Health on the issue of food, the EHPs on the ground, the food health, as well as environmental health directorates in the Department of Health are now on full alert working with the Commission. I hope we never have to work that way, CEO. I hope that those kind of incidents would never come to this, touch wood, they never come to this industry, because then it will put us on beast mode and we will be on the ground to make sure that we hold you accountable. And also, just in terms of your responsiveness, what we also require is that as and when there are problems with your product, please be responsive. Let your first manner of response not be to lawyer up, because we see through, we already know immediately when there is a problem with you, when we ask you a simple question like, is it Tuesday today, and you bring counsel, we know that there is a problem. So, so it's very important that this dialogue always happen. And I'm glad that we are now at a point where we're looking at regulation. And I hope with my presentation, I've convinced you to also just allow as much regulation as possible within the space so that we don't have to step in as the big sisters of consumers. Thank you very much.
Thank you, Memilo. Ladies and gentlemen, that brings us to the end of the presentations, and we'll be starting discussions. For the purpose of the discussions, I would like to call back all the speakers that got to the podium. Okay, not all of them. Memelo, please return. Dr. Tembo, return. Memfuku and Mebembe, please return. I have chairs that are more comfier for you here. Yes. So we have questions both online, and I believe there will be questions from within this venue. They will be answered by the colleagues that are coming to the fore right now, as well as the SAHPRA CEO, who is seated among yourselves in the audience, and Ms. Silvarani Pareachi, who is also seated in the audience. How we will do this, we will start with 5 questions online, and then we'll come to the venue. We'll take 5 questions, and we'll alternate like that. The questions will be read by Ms. Melanie Govendasamy for online, and for the colleagues that are present physically, you'll raise your hand, you'll be recognized, you'll introduce yourself through your name, the organization you represent, and you'll ask your question. We can move to the questions online. Ms. Govendasamy, 5, please. So you may start at the beginning of the questions, those that are not answered. So if there are those that require simple question answers on the Q&A and they are answered, you may skip those. Those that require engagement, you may read those. You may give us the first 5, and then we will allow the venue to ask 5 questions after the first 5 are answered. Thank you.
Thanks. So this question is from Michelle Fitzpatrick. Can feedback please be provided on the backlog of the CAMS unit, which already exists on the current process of license listings, and how much worse will it get when CM's registrations become in effect? Also, please comment on the lack of communication response from the CAMS unit, whether via the website or emails. No response or feedbacks are being received by multiple companies. That's question 1. Should I go through all the questions and then?
Yes, please.
Okay. Second one from Njabulo Mbata. Does a marketing agency that deals with or owns complementary medicines require a responsible pharmacist? 3 from Darren Duplessis. Is assigning different registration requirements for low risk and high risk CMs essentially a separate scheduling system? 4, this is from Tremaine Naika. Please provide further clarity on the definition of Schedule 0. Which class of substances fall under the schedule? And the last one for now. On the portal, so this is from Anne-Marie Greber. On the portal, some companies have received approval as low-risk health supplements for conditions such as macular degeneration, a dread disease that does not appear in Guideline 7.04. For other companies, calls were assigned high risk. Please provide clarity.
Thank you.
Melanie and colleagues, I hope I'm audible enough. The first question that talks about the backlog in the processing of CAMS applications. I think we need to put perspective into what is deemed to be backlog in the processing of applications. We have a number of applications that are in the systems that we have reviewed. Some of them at different stages of evaluations, and some of them almost at the stage where a regulatory decision can be made. Now, most of these applications, the so-called backlog should not be only deemed to be a SAHPRA problem. We communicate with the outcome of reviews with applicants. And in most cases, we receive a request for extensions for unlimited time. We also do not receive feedback or responses at all until we start calling individual applicants and following up. There could be reasons why some responses are not received, because some applicants would refer to some CAMS outstanding matters. So when we look at what is referred to as backlog or the carrying over of applications through to the next rounds and all that, it should be looked at from the perspective of what happened from when an application came, what happened from when the evaluation was done, what happened when the response was sent, what happened when the applicant received the response. So the processing of an application will depend on how soon the evaluation is reviewed and how soon the applicant responds to the SAHPRA letter. If I may indicate to industry, I think in the last year or two, we worked on reconfiguring the SAHPRA portal, where in an application that comes today will immediately be ready for allocation within a day or two. And our evaluators have been working around the clock to make sure that the review process happens within 15 working days. Now, with that, we send out the evaluation outcome to applicants, and they are also given 15 working days to respond. And if we are to do an audit of how many applications in the system have not been responded to, it will be something that may be shocking to all of us. Now, we also have about 6-7 different license types. Now, if we send out a response on a particular license type, we would be dealing with that license type at a time. And once we're done, we move on to the next license type until all the 5-6 license types have been reviewed. And in that way, we ensure that each application within the system have a fair and equal chance of review. Now, the part that we're still working to improve on is those applications for which we have finalized or we have a SAHPRA final letter. So there has been proposals from industry that such application should not follow the queue, but rather be prioritized. So that is something that we work on. So the perceived backlog that is being seen in the unit depend on a number of factors, including the non-response from applicants. Question number 2, marketing companies are required to have an RP. As I indicated during the presentation, as long as you are dealing with medicines, The Pharmacy Act provides for the responsible pharmacies to be in place. And I'm hoping that the colleagues here will further elaborate on the requirement of the responsible pharmacies insofar as this kind of companies are concerned. Can you repeat question number 3, Melanie? It talks about scheduling.
No, sorry. Is assigning different registration requirements for low risk and high risk CMs essentially a separate scheduling system?
What does signing a different, or assigning, assigning a different registration system?
Let me assist you. So we've got the assignment of either low risk or high risk. So the question is that now becoming a scheduling system?
No, you see, the scheduling depends on the risk of access. So low risk products will mainly ordinarily be Schedule 0. I mean, we can give examples from on those that are already scheduled as Schedule 0 and registered as such, if you take Panado, for example. And the high risk product will be scheduled according to the level of risk that that individual product present. The fourth question was clarity on
The definition of Schedule 0.
the definition of a Schedule 0. Schedule 0, like I'm saying, are dependent on the level of risk. And the level of risk will be determined by the authority, like in the case of health supplements. All health supplements are ordinarily Schedule 0. So the level of risk associated with a product will determine the scheduling status of it. If the authority deems the product to be of some element of risk to the user, then the scheduling level will be upped. But a Schedule 0 substance will ordinarily be those that are deemed not to be of any risk to the consumer. The example could be, in this case of complementary medicine, the health supplement product. The fifth question says, on the portal, there has been approval for some products with high risk claims and there as low risk, and those that are high risk. It would be best that SAHPRA be provided with that specific product that has been indicated as such, and we will look into it and answer the question accordingly based on the information before us. So for now, I'm unable to determine which application or product is specifically being referred to, but as soon as we receive such information, I shall respond accordingly. Thanks, Melanie.
Thank you. Yes. Any further comments?
Thank you. If I may add to the second question of the requirement of an RP at what we will term marketing company. In terms of the Pharmacy Act, if you're going to be registered as a pharmacy, the owner or the applicant shall then appoint a responsible pharmacist. And in the definition of the pharmacies, of the pharmacy itself, if you look at the regulations relating to the practice of pharmacy, it will state the services that are being offered in that pharmacy. And therefore, as such, the requirement of that the responsibility or the requirement of the responsible pharmacist for that pharmacy is in terms of those services. And if they are aligned, whether it's one or more, it is the same as whether in that pharmacy any of the persons, or let me say pharmacists in this regard, would be offering any of the services in terms of regulation 3 and 4 of the practice regulations, which talk to the scope of practice. If one or more of those would be performed at that facility, then that's where you would need that registration as a pharmacy. And once there is a pharmacy, you require a responsible pharmacist. You can't have a pharmacy without the responsible pharmacist. Thank you.
Thank you. I think we will move to questions from within the venue. First question. Yes, ma'am. No, yourself. Yes.
Thank you. My name is Henriette Vennings from MRA Regulatory Consultants. My question relates to I know this is a hard question to answer, possibly with much accuracy, but when are the amended regulations expected to be published?
Okay. Yes, ma'am.
Good morning. Thank you for this. My name is Boseli Nkana. I'm a representative of the DSA. As a trade association, we appreciate and fully agree to being regulated, our products being regulated, fully aligned with the CPA because consumers come first. But the ask is a sit-down discussion around regulating these products, not allopathic inclined, meaning they are low risk. We've all said it is for healthy people. Why are we regulating it as medicines? Your typical medicines that will require scripts.
Thank you. Sir, your hand up.
Hi there, my name is Coblin. I'm representing the HPA. Could we address the issue of the CTD, please? Thanks. Could we address the CTD format for CAMS, please?
Yes, ma'am.
Thank you for a good and informative presentation. I'm Lashanya from Chiron Animal Health. I just wanted to know products for veterinary use, are they within scope for category D medicines? Thank you.
Thank you. Last question from venue. None? I'll give over to the panel to answer the 4 questions. Yes.
I think the first question, when will the amended regulations be expected to be published? And I give that to the CEO. Okay. And then the second question is more of an ask of the sit down for further discussion. Is that what you're asking me?
It's a two-part, is the ask and also the conditions. Regulatory conditions, for example, the CTD, it's very allopathic inclined. If we're considering low-risk products, why are we looking at regulating it as a higher risk medicine, for example? So the discussion is an ask for how we can actually find a way to, I wouldn't say create, but have a workable and amicable regulation that does meet all the requirements in terms of the CPA. Thank you.
I think the same question the CEO can take, because he's also asking for a possible sit down as well. The third question talks about addressing the CTD for CAMS. I know that SAHPRA is busy working on possible consideration of a conducive format for registration of CAMS. And maybe the CEO will also expand on it. there will be a separate engagement, like in this forum, possibly next year, early next year, where the engagement on the format of submission will be discussed. The last question was veterinary products for use in camps. If you look at complementary medicine or the classification in terms of Regulation 9, it says medicines intended for use in humans and in animals. So there are complementary products that are being considered for use in animals. So we have been reviewing applications that we received of such products. Yes, the answer is yes. Veterinary products that are of complementary origins are allowed under category D. Category D. I'll hand over to the CEO.
Thank you. I'll address some of these, and Silverani, please chip in where required. So I'm going to make some general comments, right, which will hopefully assist in the question of what is it that we're actually regulating. So if you look at Schedule Note, which someone had asked about Schedule 0, as a regulator, we also regulate that, right? And how that determination is made, whether a product falls under Schedule 0 or Schedule 1, is that we have a committee that looks at each active, in essence. And in that consideration, and even when you look at the act defines what a Schedule 0 is, Schedule 1, etc. But we would take into account elements such as the safety of the product, whether this product can be abused, the risk level, the tolerability, etc. So there's a whole kind of science that goes into determining these schedules. But even if a product is a Schedule 0, we still regulate it as SAHPRA. Yes, in terms of the risk level, it would not be the same as a Schedule 4, etc. And also, just to correct, we don't only regulate those products that are prescription products, even a Schedule 1 and many over-the-counter medicines that you would find, we still regulate them. And hence, even in some of the comments that Kaiser and other colleagues made, is that even though a product is low risk and is therefore then and could be determined as a Schedule 0, it would still need to be regulated by SAHPRA. So I just want to clarify that, because even in some of the responses we got from HPA, there's an assumption that scheduled substances start from Schedule 1. That's not correct. It starts from Schedule 0, and we therefore then regulate that. And so you're asking for a round table. This is the round table, right? I don't know what else we would need to discuss, because there is that clarity. And I think the scheduling part, once we align on that, it will assist a lot in there's been a broader question around, we are still overstepping, even after the Concord judgment, we're still overstepping and regulating what is not a medicine. And this guideline, is it 702 that we published, aims to clarify that once we determine that a product is a medicine, then we step in a SAHPRA. We have to regulate that. There'll be many others that will not be medicines as per the definition. Again, if you look at the Act, you will find the definition of a medicine, right? And so hence then guideline 7.0 is published to provide that clarity. Yeah, you'll have some borderline products, right? Such as some of the vitamins, wherein the minute you are exceeding a certain concentration or certain units, it starts being then a medicine based on the risk level and the scheduling. So to Kaiser's point, some of these matters will need to deal with them on a case by case, because there is almost that borderline, and guideline 702 also speaks to how we will address those that are almost in that borderline space. But we will regulate what we consider as a medicine, and a Schedule 0 product is still a medicine. And that for me needs to be clear, because I think that's at the crux of this misalignment that we have. And therefore, then to the point that Zianda made, when then it is a medicine, you therefore then need a responsible pharmacist. And so again, I really need us to put this matter to bed, because there's been a question about responsible person, the skill sets that are required. Again, we are dealing with products that have a risk level as per the schedules. And because they are medicines, you therefore then need a responsible pharmacist. If you're dealing with anything that is not a medicine, then you will comply with whatever other regulations that are relevant, whether it's the food regulations, the cosmetics regulations, etc. But wherein it is determined to be a medicine, you will then require a responsible pharmacist. You will then require to be licensed. And Mendy spoke adequately. There was a question around running this as a parallel process, that it therefore then cannot be. And she spoke adequately to why the DG needs you to have Pharmacy Council and SAHPRA decisions before you can then be licensed. So I hope that clarifies the two questions. In terms of the CTD format, we thought, and the team has done some work around that, we thought let's first at least align on these principles and finalize these principles. And I know the COO will be scheduling workshops so that we can then engage on the need for CTD format or folder structure or whatever we will end up with eventually. I hope that helps. Happy to take further questions.
Thank you, CEO.
Thanks. I just want to add a little bit to, in terms of the scheduling, it actually talks a lot to the access of medicines. So with Schedule 0, 1, and 2, a person may possess Schedule 0, 1, and 2. And that Schedule 0 can be sold from a shop other than a pharmacy. So it does talk specifically to the access, but it does not say it is not regulated. All things in the schedules are to be registered. So those are the processes that we do follow. In terms of the CTD, or maybe before I go to the CTD, maybe to contribute to the fact that information that is submitted in the registration process talks to the quality, safety, and efficacy of that medicine. And to the question that was raised that, for low risk products, why do we have to follow CTD? And the point here is that CTD is a format. It allows you to organize your information. So it allows you to organize your information. It does not mean that if it's a low risk product that you need not submit information. We still require information, perhaps more so on the quality, which talks to the CPA. Every patient is entitled to be given a quality medicine. And of course, safety aspects, you may not find that you have sufficient information with regard to all the studies, but it's known and it's researched to have contributed to those indications. Those will be requested in terms of the classification. So when we talk of CTD, it doesn't mean that everything that you read in terms of the M4Q is what you're going to submit. We are currently busy with organizing what we need for the format, the CTD format for complementary medicines for low risk and high risk. And we will then communicate that these are the information that you need to submit in that format. So I think we must move away from the fear of CTD being this big explosive or extensive document that you need to have every bit of information. So we are working on that. And for complementary medicines, low risk will obviously have less information requirements than would be high risk. So I think that's where we're at the moment. And as CEO has indicated, we will have a workshop later on the CTD once we formalized the specific requirements.
Thank you, Ms. Parayachi. There was a hand from Dr. Goa. I don't know if he's still interested in making an input. If you are, please unmute and make input. Okay.
Yeah, it wasn't me. I don't.
Yes, I just wanted to acknowledge the presence of our two committee members. Is it two or one? Two, yes. Please, if you want to comment, just let us know. Welcome, both of you.
Ladies and gentlemen, we'll move back to online. Ms. Govindasamy, those questions, please.
Thanks, Madam Major. Sorry, I'm just scrolling. This is from Lienta Rolofsa. Apologies for not pronouncing it properly. Just to confirm, answer to question number 9 and 10. Dr. Tembo, this is for you. Will SAHPRA then allow for ISO 9000 or FSSC 22000? That's one. This is from E. Todd. Why would Port Health not release a consignment approved by SAHPRA and indicate that it is with SARS? I'm not sure if we're going to be able to answer that. Port Health would be able to. Third one. From Raisa Osman. Why are products detained while they are on an approved 3D list? Question 4. From Singh Shaista. Products have been applied for and registered as Schedule 0. However, the active substances were not added to the list of schedules. This causes a lack of alignment in industry as products with the same substance are being imported as a CAM and are further referencing the registered product in the claims being made. Will active substances for Schedule 0 products be added to the schedules under Schedule 0? How many is that? Is that 3 or 4? 4. Okay, the last one. This is from Christine Rochnell. Can all ingredients that have been approved under Annexure B thus far, with their specific indications and minimum and maximum dosages be published for the whole industry to see? This will prevent the duplication of applications by many stakeholders for the same ingredient. I think that's it.
Thanks, Melanie. The reference to the ISO standards, you would recall that I said, if any standard or reference is relevant in the production of a particular product, submit it, we will review it, and if your submission is relevant to the production of the product, we will accept it. I indicated that our guideline does not prohibit any submission of or provision of a standard or reference to substantiate the production of the product. So the ISO standards, if they are relevant to the production and motivated for, we will consider that. The Port Health not releasing consignment that have been released by SAHPRA. Remember, as SAHPRA, we recommend release of the product or the consignment after review. I am aware that some of the challenges of not releasing happens when they are in the same consignment, products that are not compliant to the CAMs. We have seen, maybe not in all cases though, where a consignment would contain category D products, but in addition, other products that should not have come through the category D route. So as the unit, we will look into what is compliant and conforms to be a complementary medicine. And unfortunately, the unit does not have the authority to can instruct Port Health to split shipments. We don't have that responsibility. I mean, the authority. But in cases where the consignment as a whole has been recommended for release, but SARS maybe refused to do that, the importer can contact us. We will engage with SARS to get an indication of what is it that is holding back. But I'm only saying for those that the whole consignment. If there are those consignment with part products that have category D and part that are not category D, we will only talk to what is a category D. The other ones have another route to follow. I know that there's also a process that SAHPRA has been engaging with SARS, particularly with the tariff codes, but that is still work in progress. The third question is products that are detained that are on the 3D list. In my presentation earlier, I said anything that comes into the country is going to be detained by the port of entry. Now, it becomes the role and responsibility of the importer to present relevant documentations that would enable the port of entry to assist in the release. In the case where the product is already on the 3D list, I mean, that 3D list is already on the public domain in terms of the register that is published on the SAHPRA website. I assume that the importer who says the product is already on the approved 3D list already hold a license. Produce the license to the port of entry, refer them to the SAHPRA register of approved products, and if the two are confirmed, Port Health will not have a problem to release. But it is not given that because you have approved list of products, therefore the gate must be open. There is still process and work that needs to be done at the port of entry to verify what is it that you are bringing, whether approval is granted or not. And on the basis of presenting those documents and also referring to the approved list on the register, Port Health will assist in the release. There is also a question on application for registration as Schedule 0. I'm not sure whether the use of the word registration insofar as complementary medicine is concerned now is appropriate, because the applications that you are getting are not for registration but for licensing. And the determination of whether a product is a Schedule 0 or not, unless if such a product is a supplement, can be determined during the registration process. And then, can all ingredients be published on the schedules? Did you want to take it, Sam? Huh? I saw you raising your, okay.
I thought you missed out the word active substances. Because they said active substances to be added to Schedule 0. So if you want to respond, please go.
You can take it.
Okay, so I think with the comment that Schedule 0 list is not included, and some of the active substances that are not added to the schedule notes. So I think our request is that if you do believe a substance needs to be added to the schedules, there's a process by which you apply to SAHPRA, and this will be taken, as the CEO has mentioned earlier on, to our names and scheduling committee, and of which it would then be considered and the merits assessed as to whether it gets included into the schedules or not. So it's not that, you know, there's no list. Yeah, too wide. So you want a specific list, so it's not. Yeah, because it's too wide a list to be included. But then I think if you are requesting for us to publish it, then it's not possible as a schedule note. But submitting it, we will determine whether it belongs to a schedule note or not.
Thank you. Further questions from within the venue? No questions. Online?
There's lots.
Oh, there. Okay, can come back to the venue. Yes, sir. Yeah.
Hi, Wayne Robinson here representing the HPA. Just in terms of health supplements, and that's an Annexure Bs, and that if a product is not on guideline 7.04, and that's either in the source or the limits, and that an Annexure B is submitted, and that SAHPRA thankfully acknowledged that this would be the case and has allowed for the process in guideline 7.04. In terms of just processing those Annexure Bs, there's a lot that's actually been sitting there, and that's either to be approved or rejected, and that's ultimately holding up people's applications at the moment, and also holding up shipments being released at Port Health. SAHPRA has recently only just stopped, and that Annexure Bs, products with Annexure Bs from Port Health being released, where previously they would allow those through. Is SAHPRA looking to increase this capacity and also looking at streamlining the process?
Thank you.
Hi, my name is Sello Malete. I'm from Kenview. My question is more related to the initial part of the question, but I think I'll just change my question now and ask directly in terms of the scheduling. Are we to assume that actives that are not listed in any of the schedules will then belong to Schedule 0 in terms of camps?
Yeah. Any other questions? Show of hands. Yes, ma'am.
Afternoon, it's Tammy Gopal. With 702, the transitional period for licensing is obviously surpassed. So when the amended regs are actually published, what is SAHPRA's view for the transitional period for licensing? And secondly, do we have any insight on call-up of these products and the period that you will allocate to it? Thanks.
Ask another one, thanks. In terms of guideline 7.04, and that's with Annexure Bs that have been approved, is SAHPRA going to be updating guideline 7.04 to include those in, whether it's a new API, new source, new limits, new indications? And then also is SAHPRA looking to expand on the annexures and that's on those? An example would be postbiotics. We've got prebiotics, we've got probiotics, but there's no category for postbiotics. And it seems kind of, with it being a novel industry, and that especially overseas, those become more relevant. And I know in South Africa, we would want those.
Yeah. The panel looks like they are all SAHPRA questions.
Thanks for the questions. With regards to the annexure Bs that are provided and whether there will be an increase for capacity and streamlining of process to be able to can attend to this. You would appreciate that when you submit an annexure B, you are actually motivating for a particular substance to be included in the annexures in the guidelines. Now, there are different scenarios to this. An annexure B can be received, evaluated, and questions or queries be raised. Now, in the case where questions are raised, we have already communicated with those individual applicants. Then those that have been reviewed and either recommended to be granted or refused, there is a process to be followed. Remember, the initial intention of submitting an annexure B is to request consideration for inclusion of such a substance in the guidelines. Now, meaning after the review of such a substance, and if SAHPRA is of the opinion that this substance can be granted, there's a process to be followed. Like, for example, it has to go via the advisory committees for consideration and ratification, as well as included in the guidelines published for public comment, because you cannot just include something on the guidelines or change the guideline without providing it for public comment. Similarly, with the refusal of those other annexure Bs. If it is also refused, it will follow the process where it goes to the advisory committees, and a recommendation will be made to refuse the request for inclusion of the substance in the annexures. It seems or suggests that the process that I've just outlined is deemed to be delayed because of capacity. Am I correct? Yes. It is not because of capacity per se. It is because there is a process to be followed. I have received inquiries from applicants where they submit on Monday, this Monday. By this Friday, they expect me to have made a decision on it, forgetting that this thing has a process to follow. It comes to the unit, it is allocated to the reviewer. The reviewer's report has to serve at the advisory committee, and also take into account that the advisory committees have scheduled annual meetings. So if you submit now, we will review it, it will serve in the next advisory committee meeting. So if that process is clearly understood, then applicants would not give me an application on Monday, and on Thursday they expect me to give an outcome. The second question of assumption that actives not listed is considered to be a Schedule 0. I don't think that is the case, because Silverani just indicated that if the active is not indicated in the schedules, there is a process to apply for it. And depending on the outcome of that review of the application, a determination will be made whether it's a Schedule 0 or a higher schedule. The guideline 7.02 transitional period having lapsed. Remember, we saying in guideline 7.02, the deadline that we imposed there, we said it is a priority review, but we never said if you come outside the deadline, we will not process you. We are still processing those applications even now. The only thing was, at the time when the deadline was put, if you come outside the deadline, we were going to prioritize those that came during or before the deadline. So the deadline does not prohibit any submission of an application, nor the review of any application. We are still doing that now. And then I think I've touched on the updates of Annexure Bs and how it's going to affect the guideline 7.02. And then you also expanded the question on whether SAHPRA is going to consider expanding the annexures to include postbiotics. Wayne, am I correct? Yeah. Yes, the consideration of postbiotics, I will take it up and then check with internally if that can be something to be considered, and we will communicate. Thanks.
Thank you.
Thank you. We may switch to online if there are no further additions from the panel on the floor. We may go online, please, Mel.
Thanks, Madam Major. This is a question for NDOH from Akira Bura. Please explain the process of reapplying for a reprint of license with NDOH. This is from Madeline. If we already have a SAHPRA wholesaler license of medicines, do we need to apply additionally for a wholesaler license for complementary medicines? This is a long one. It's from Rudy Martins. We cannot ignore the rulings in the court cases between the ANHP and NDOH SAHPRA, which determined that they are non-therapeutic products in pharmaceutical dosage forms, which falls outside the ambit of Act 101. One of the biggest challenges is determining which products fall into this category. Further, since these products are not considered foods or medicines, what do we follow in terms of regulatory requirements? This impacts so many areas, for example, manufacturer owner licenses and certification, importation, labeling and advertising, as well as registration requirements. This is from Prince. Can we submit a DA01 application while there is another DA01 in review with SAHPRA? That's part one. Part two, can the CM's unit present the stats and the number of applications received, approved, etc.? That's typical. This is from Raisa. I think this is the last one, Madam Major. This is from Raisa Osman. Does a compounding pharmacy fall under Pharmacy Council only? So what are the rules for this? I think that's for Zianda.
Take it to the panel, starting with Mebembe from the DOH.
Thank you for the questions. One of the things that, as I said, that we have done in terms of reforms and streamlining is to align the license that the Director General issues in terms of the Pharmacy Act to the license issued by SAHPRA in terms of the Medicines Act. And so we understand that there are people who might have licenses issued by the DG that did not have the condition of an expiry date, which I spoke about, and the condition that refers to the fact that our license is valid provided that the person complies with the license issued by SAHPRA. So there's a process of reprinting licenses. And if you go to the Department of Health website, so you would reprint once you have received the license from SAHPRA, whether it is your renewal after the 5-year period and you receive a new license, then you would go onto the Department of Health website, www.health.gov.za. Under services and links, there is licensing unit, and in that part, you will find application forms. The application form for reprint after SAHPRA renewal is there. Therefore, you then apply to the Department of Health with the instruction that's written there, submit your SAHPRA license, because we have to have the amended SAHPRA license or the renewed SAHPRA license so that we can pull, excuse me, the expiry date and we can pull the number of the license from SAHPRA. We want that license with its annexures so that we know exactly what was in that previous one. And so we would then reprint the license, and you would need to inform the Pharmacy Council of the reprint. We usually keep the same license number. And so the only thing that would be there is an expiry date now, and at every point of renewal of your SAHPRA license, we expect you to then apply for a reprint of the DOH license. Thank you.
A question on whether when an entity already have a wholesale license, do they need to apply for a new category D license? The answer is no. Remember, there are entities that already hold different licenses, whether it's wholesaling, manufacturing, importing, exporting from the pharma side. Now, if you want to include category D products on your activities, as the holder of a pharma license, you will be allowed to come through the SAHPRA portal CM and apply for a DA02 type of a license. Not a license, a DA02 type of an application, because you are not going to be issued with a new license. The DA02 is intended to enable after review, append your category D products to your existing license, whether it's a pharma or otherwise. It has to be appended through the DA02. So we will not issue you with a new license, but we will append your product list to your license and publish such on the register if approved. The other question on the court cases and products that are not non-proprietary. SAHPRA currently take its guidance on what the court has pronounced. The court has made it clear that SAHPRA can only be dealing with what is a medicine and what is a scheduled substance. Now, if a product meets the definition of a medicine and or a scheduled substance, SAHPRA will regulate and control it. We are aware that there are those products that may be of borderline origin. And that is why, as SAHPRA, we have initiated a dialogue or engagement with the Department of Health, Food Control, where we're trying to engage on issues of mutual interest, including looking into those products that can be either on the other side of Act 101 or the food. And that dialogue is fairly new. We have started it, and maybe through with time, and I'm speaking under correction, we will be able to can support either between the Department of Health and SAHPRA those products on a case by case that are not medicines. But as of now, we are dealing with products that are either medicines or scheduled substances as per what the court has pronounced.
Okay.
Sorry to interject. I wonder if our committee members maybe want to comment on this point, because we've engaged on it extensively. And I think it is important that when we walk out of this meeting today, there's understanding. We may not agree with each other, but we've taken a decision, and we are of the view that this decision aligns with the Concord judgment. So I don't know if our committee members want to comment.
Thanks for the opportunity. I think it's Kaiser's quite correct with respect to the guidance that is given over anything that is a bona fide medicine or defined as a scheduled substance. Things that are outside of that are not subject to regulation by SAHPRA. And at the same time, SAHPRA can't provide an answer as to what it is that happens to them, because what it is that's within their purview is medicines and scheduled substances. But as what it is that we've heard today, that those products that then lie outside of that framework or outside of any other regulatory framework is then subject to control under other legislation, such as the Consumer Protection Act. That's really the nub of the question. But absolutely, the things that then are bona fide medicines and scheduled substances are those things that would be subject to regulation. I wonder if I may as well just take an opportunity just to come back to the Annexure B question as well. Is that Annexure B is absolutely, once it is that they're have gone through a process and they get to the point of being approved, absolutely that would be published in the guideline 7.04. First of all, for public comment, because like the entire guideline, it goes out for public comment and then finalized. So it is then viewed for those updates on 7.04, which there are many, also just waiting on the finalization of 7.02, which then gives a clarification of those risk principles as well. So as soon as that's implemented, then you will find the 7.04 updates get a lot more traction. I hope that helps.
Thank you.
Do you want to?
Thanks. The last question from my side was, can an entity submit a DA01 while there is another one in process? You can submit, but be aware that the new submission will impact on what is already in the system and how far it has progressed. Remember, if you start with 10 products as your initial DA01, and that 10 products have been allocated for review. There has been correspondences with the applicant. And then in the process, you submit additional GA01. Remember, the 3D product list remain the same. You just extend on what is in there. Now, it means in the second 3D list, you are going to start at product 11. Remember, the first 10 is still under review, possibly very advanced. Now you're adding another 15, starting from product 11 to 25. And that second GA02, the evaluator will have to now look into this whole 3D list in conjunction with what he has looked before in terms of 10 and what you are including now. The 10 that he has looked at still remain the same as the other 10. So you can submit, but take into account that the effect that is going to have on the processing of your initial application. And we see that a lot where somebody now start following up to say, I submitted my Annexure B in January 2024. I mean, not Annexure B, DA01 in February 2024. And then you followed the same Annexure, I mean, DA01 with another one in May. Forgetting that for us to finalize the DA01 of February, we have to take into account what you are submitting now. And in most cases, what we advise is that if your application is still in progress, like for example, the DA01, the first one, and we're still asking questions, you can seize the opportunity by including additional products in your response to the SAHPRA letter and indicate in that letter what is it that you have included. So in that way, the review just continue as one DA01. Thanks.
Thank you, Dr. Tembo.
Thank you. To answer the issue about the pharmacies offering compounding services, and I'm running away from saying compounding pharmacy because there's no such category of pharmacy in the law. The simple answer is yes, the jurisdiction would be that of the Pharmacy Council, because these mainly are licensed as community pharmacy licenses with a condition offering compounding services only. However, where there is medicines, the owner of the Medicines Act is allowed to enter. So just because we are a community pharmacy institutional, it doesn't mean a SAHPRA inspector may not walk in. I just want to start on that premise in that regard. And what we have seen as applications for these pharmacies, and when you look at Regulation 3 of the General Regulations as amended in 2022, you would see the role of SAHPRA in inspecting these pharmacies with the issue of the 30-day use, the amendment of the regulations. And I must on the services being often reformed, and we were this past Monday to just finalize those processes. The Pharmacy Council is looking at minimum standards in these pharmacies that are offering these particular services. And so, yes, at this point in time, it is under the licensed as a community pharmacy, and therefore does not require a SAHPRA license. But in its management, look, the GPP says even for extemporaneous compounding, you must compound in line with GMP standards, even small scale. So it is very important for us to note that you can never separate compounding in any form, whether it's that small tube that you're going to put in Archaea's cream from GMP. You can't just now take a dirty pestle and mortar and start. It's product quality that you're going to be offering out there, that you're going to be giving out. So yes, it is licensed as a community license, but other discussions are underway. I'm not sure also if the CEO would like to add following the discussions we've had this past Monday, if I'm leaving out any detail.
Just a quick one on products that are then not licensed or do not fall within the medicine category. I think the one aspect that I left out from my presentation is the requirements for labeling. Section 24 of the Consumer Protection Act requires that products be labeled country of origin and also for them to have ingredient lists. So there is no way around it. So it doesn't necessarily mean that those products, there aren't any requirements because consumers need to know what they're consuming. So the Consumer Protection Act also still requires that when you manufacture products and you distribute or sell products, they are properly labeled so that consumers know what they're consuming. Thank you.
Okay, see you.
Thank you. I saw there was another hand maybe on this point, but just to align with yourself that as SAHPRA and the Pharmacy Council, we definitely are dealing with this issue. And you may have seen a few communications that we've issued recently on some of the risks we're seeing with compounding and how it could also contribute to substandard products. So again, to the point that our colleague from the Consumer Commission has said, safety is critical. Safeguarding the public is critical, and we are seeing risks with compounding. But you're absolutely right in everything you mentioned.
Thank you, Sue. Sure.
Yeah, I just wanted to add that there was a compounding guideline issued by SAHPRA for the licensing of compounding activities in pharmacies. It went through a review cycle, comment cycle, etc. I'm assuming it's quite advanced in terms of being finalized. And the licensing will be from SAHPRA side under Section 22A, not C, because that provides for the licensing of compounding activities. So we'll definitely see some new categories creeping in, probably for both SAHPRA, Pharmacy Council and Department of Health around that, because it is a major issue in terms of quality. And we saw that with COVID as well. We all of a sudden, all sorts of products were being made that actually was somewhat mischievous. I would just still like an answer on the question of the expected timeline for the regulations to be published, please. Thank you.
Thank you. Apologies. So one of the things we wanted to do before we finalize this was to have this session so that there's alignment and you get a sense of where we're leaning towards. So as I said, we received your comments to the draft regulations, and many of them, at the core of the comments, really, it's the definition of the medicine, which
in terms of the scope, and we now hopefully understand the position that we've taken. And once we identify the original from the background, there is to work on the different results for assessors. So for me, that's important that we align as a total when we have one community.
I just add to the question on this is clarification of compounds and pharmacies, and that decided to say a country providing the services of compounding. The pharmacy that says the five categories, and then with each issue the license, there's a guidance document to applicants, the norms that the DG applies in the agreement. And as I said, for community pharmacy, there's norms around the population, norms around the distance, shopping centers. And this is for pharmacy that said they would provide certain specialized services. And these are covered in section 1.1.7 of the guidance. So it is a pharmacy that would be providing these services, and they will apply to the public health, the Director General. The DG reviews this, and sometimes we call on SAHPRA to say, well, now inspector went there to see what it does not look like a normal compounding pharmacy. And this is why it's a normal community pharmacy. And then SAHPRA would assist in checking are these manufacturing services, which should best be able to say apply for a manufacturing
we then exempt you because you're not providing all the services a pharmacy would provide. And we also would be able to license another normal community pharmacy, for the lack of a better word, next to you, because you are providing a specialized service, which is around compounding, maybe for ophthalmic products or whatever it is that you have put in as a motivation. It is really for you to be exempted from the application of the norms. There's nothing called a compounding pharmacy. It is a community pharmacy, but it is providing specialized services. It is the same for clinic pharmacies that are providing clinical trial services only. Again, those ones would be exempt, and the license would speak to clinical trial services only. And again, we are able to then say, no, there is a pharmacy here, it is on the register. However, it's only providing this service. Therefore, we can have another pharmacy next to it, which is a normal community pharmacy. And I think it's something that's really important. And naturally, as DOH, we're also quite excited if there's going to be some level of working on the compounding pharmacy as now a compounding pharmacy, because it's a bit of a line. It's a fine line, because any pharmacy can actually compound. And so it's just that when the person wants to be exempt from the norms applicable to the evaluation of those applications, then they would state those services and say, I'm only going to be providing these services. Thank you.
Yeah. Guys, for a question here? Yes, sir.
Hi, thank you. I've got a two-part question. So it's regarding African traditional products. Firstly, will they fall under category D by the definition of a medicine? And number two, if they do, then would traditional healers, by virtue of them compounding, be required to have a license? And would they have to have a responsible pharmacist employed? Thank you.
African traditional medicines. At the moment, African traditional medicine is not part of the category D medicines. It's not. But SAHPRA has initiated a process and work has started into looking into the possible framework that these African traditional medicines can follow. And it will be on the basis of that framework that is going to determine where the African traditional medicine is going to reside. And once that is done, and there is clear indication of how African traditional medicine is going to be regulated, the issue of traditional healers being expected to be holding particular licenses or otherwise may be informed by the whole process that is being undertaken by SAHPRA for now. But I don't have much details as to into what will happen once the framework has been developed. I'm not sure if Dr. Tin wants to add on that.
Thank you, Dr. Temba.